Did you know that some common signs you ignore might mean your kidneys are getting weaker? I start with that because it grabs attention fast. Today, I will walk you through 6 surprising signs, what usually causes them, and the exact steps you can take right now to protect your kidneys. There is no herbal fix that replaces a medical checkup, and if something looks serious, you should seek care promptly. I am Dr. Emily Carter, nephrologist and clinician, and I will explain this in plain language so you can act. If you want more practical health tips, subscribe and share this with someone who might need it. First, I will explain what kidneys do, then we will define the problem, compare sudden versus long-term damage, review causes, list the 6 signs to watch for, go over the tests your doctor will ask for, and end with simple steps you can start today. If you have high blood pressure or diabetes, pay close attention. Now let us begin by understanding the role of the kidney. The kidney filters blood, I say, pointing to a simple diagram. It balances fluids and salts, adds Mark, the nurse in the clinic, tapping the chart. It helps control blood pressure, I continue, and Jamal, the trainee, asks, how does it affect bones? Through vitamin activation and mineral balance, I answer. The room smells faintly of sanitizer and paper. The clinic clock ticks softly, and sunlight cuts across the countertop. You can imagine the kidney as a kitchen sieve that catches what the body should keep and drains what it should throw away. It filters waste from the blood so you do not accumulate toxins, it regulates sodium and potassium so your muscles and heart work well, and it helps make hormones that control blood pressure and keep bones strong. Picture the sieve getting clogged a little at a time. It becomes less efficient. You might notice changes in how often you go to the bathroom or feel puffiness in your ankles after a day of standing. The urine may look different, or you may feel tired in a way that does not go away with sleep. These are sensory clues you can perceive without tests. The cool glass of a water bottle in your hand, the subtle heaviness in your shoes at the end of the day, and the metallic taste in your mouth that sometimes comes with toxin buildup. Before we move to causes, tell me in the comments which sign surprises you most, and if you or someone you know has felt any of these changes. Write "my sign" followed by the symptom and your age so I can read and respond. This helps me choose future topics and helps others see they are not alone. Now let us define the problem and its forms. Is this always permanent? Asks Rosa, a patient leaning forward, fingers knitting her sweater. Not always, I reply. There are 2 main patterns, says Priya, our dietitian, offering a pamphlet. Acute kidney injury is sudden and often reversible. Chronic kidney disease is gradual and often progressive, I say. The fluorescent light hums above us, and the chair feels cool under Rosa. An acute event can come from severe infection, major surgery, or dehydration, and may be reversed if treated quickly. Chronic damage usually develops over months or years and often has silent progression, so people only notice late. The difference matters because an acute problem can recover if the trigger is removed, while chronic disease needs long-term monitoring and risk reduction. Think of acute as a sudden clog cleared by a plumber, and chronic as slow mineral buildup in the pipes that needs ongoing maintenance. We should be honest about reversibility and risk. Can dialysis be avoided? Asks Lucas, a worried husband. I look at both of them and say, sometimes, sometimes not. If we catch the problem early, we can often avoid dialysis, but when enough function is lost, the only options are dialysis or transplant. The clinic walls feel close, and a soft beep from the monitor marks time. There is an emotional weight to that image, a hospital bed with machines and tubes, the smell of antiseptic, and a family waiting room chair scraped against linoleum. That image helps explain why early detection matters. Hemodialysis is life-saving but carries burdens and risks like infection and frequent visits. The possibility of long-term dependence is scary, and that tension is real for many families. If you have a sudden drop in urine output, heavy swelling, or blood in the urine, seek urgent care. Now let us go through common causes and risk factors with examples you see every day. I take pain pills after work, says Miguel, rubbing his temples. I use over-the-counter anti-inflammatory drugs several times a week, says Anna, lowering her voice. Overuse of non-steroidal anti-inflammatory medications can harm the kidney over time by reducing blood flow through tiny vessels. High blood pressure damages the filter over years. Diabetes, when blood sugars are not controlled, scars the tiny vessels and is the leading cause worldwide. Recurrent urinary tract infections or a single severe infection can injure tissue. Kidney stones can block flow and cause pressure that injures the organ. Smoking accelerates damage by worsening blood vessel health. Dehydration from intense exercise on a hot day, severe vomiting or diarrhea, or blood loss during surgery can trigger acute injury. Long-term exposure to certain toxins or inappropriate herbals is also a risk. Imagine Miguel inhaling the hot kitchen air after a long shift and reaching for pain pills to keep going. The bottle clinks in his hand. Picture Anna at a weekend barbecue, the taste of salty chips and the bottle of pills nearby. Each small choice can add up. When I explain this to patients, I often ask them to list their medicines and supplements in front of me. That simple step reveals hidden truths.
Risks. Now the 6 signs you should not ignore. My urine looks foamy, says Maria, tearing up slightly. I wake at night to pee a lot, says Jamal, shifting in his chair. My shoes do not fit at the end of the day, says Mark, showing me the creased sock line on his ankle. First, persistent foam or frothy urine can mean protein leaking from the filter, proteinuria. Second, swelling in the ankles or around the eyes indicates fluid retention, edema. Third, changes in urination pattern, less output or much more frequency or very dark or bloody urine indicate trouble. Fourth, uncontrolled blood pressure despite medication may point to kidney-driven hypertension. Fifth, persistent fatigue and poor appetite can be due to toxin buildup. Sixth, muscle cramps and itchy skin can be early signs of mineral imbalance. The waiting room smells of coffee and faint perfume, a paper cup tapping as someone sets it down, and sunlight slanting through Venetian blinds paints warm stripes across the floor. Each sign deserves attention because together they build a pattern. I will expand on a patient story to make this concrete. Backstory moment, long version. Patient story starts here. 2 years ago, Linda, age 54, came to clinic after months of mild fatigue and noticing her shoes were tighter. She thought it was stress. Her primary doctor checked thyroid and told her to rest. Over 6 months, she developed more swelling and found foam in the toilet. Her blood pressure was high despite 2 medicines. At the clinic, I remember the cool plastic of the chair under her and the nervous tremble in her voice as she described a metallic taste and less appetite. Her creatinine was elevated and protein spilling in the urine. We started treatment to control blood pressure and reduce proteinuria, changed some medicines, and advised fluid balance. Today, she is not on dialysis and her numbers are more stable because we caught the problem before extreme loss. Backstory, patient story ends. This story shows how subtle signals can mount up and why listening matters. Let us discuss the tests your doctor will likely ask for and practical steps you can do right away. What will they check in the lab? Asks Priya. A urine dipstick and a urine microscopy can find blood or protein, I answer. Blood tests for creatinine and urea estimate kidney function, adds Mark. Sometimes a 24-hour urine or albumin to creatinine ratio gives more detail, says Miguel. The lab has a faint chemical smell. The nurse slides a small vial across the counter and the paper label crinkles. Your doctor may also order an ultrasound to look at kidney size and stones. Key numbers to know are creatinine, which is a muscle waste cleared by the kidney, and estimated glomerular filtration rate, or eGFR, which summarizes function. Practical measures you can start today include keeping hydrated without overdoing it, aim for regular water intake unless told otherwise, avoid frequent or long-term use of non-steroidal anti-inflammatory drugs, control blood pressure and blood sugar, stop smoking, and share a full list of medicines and supplements with your clinician. If you see blood in the urine, a marked drop in urine output, heavy swelling, or sudden severe pain, seek urgent care. Small steps like carrying a water bottle, writing down medicines in a notebook, and checking blood pressure at home make a real difference. Before we close, I want to give a short moment of caution and hope. There are treatments that slow progression, like blood pressure medicines that block certain hormones called ACE inhibitors or ARBs that reduce protein loss and protect the kidney, and newer diabetes medicines that have kidney protective effects. Transplant and dialysis are options when function is very low, but they come with challenges. Picture a dialysis center with the steady hum of machines, the slow drip, and the patient looking out the window. It creates tension, but also gratitude for a life saved. If you are worried, make an appointment and bring a list of symptoms, medications, and a recent blood pressure reading. In summary, your kidneys do much more than make urine. They filter toxins, regulate minerals, and support blood pressure and bone health. 6 signs not to ignore are foam in urine, swelling, changes in urination, blood in urine, hard-to-control hypertension, unusual fatigue, and muscle cramps. If any of these occur, get checked. Start with urine dipstick and blood test for creatinine and urea. Avoid unnecessary anti-inflammatory drugs, hydrate appropriately, and control diabetes and blood pressure. If this helped you, please like, share, and subscribe to get more simple medical explanations. Leave a comment starting with "my sign" and the symptom that worries you most so I can read and choose topics for future videos. Knowledge is power. Take care of your kidneys. Your body will thank you.